talked last week about the significance of school physicals, examinations as well prior to participating in school sports activities and how it can take this to a different level. Our medical expert, Dr. David Winter, joins us to talk about the difference and importance of sports physicals. Dr. Winter, what is your view of physical examinations prior to school athletics and how important are they?
Yeah, Tashara, I think they're very important and they're actually required by most schools. We want to help to prevent injuries where we can, problems you might pick up in advance. What they're looking for in the thorough physical is heart conditions, bone and joint problems, maybe prior injuries to those, flexibility, strength, balance. Also, new emphasis recently on concussions. Concussions are very important to check for those and prior problems with concussions.
Now, I want to talk more about concussions. What is the current thinking around them?
Well, we have learned that if you've had a concussion that injures the brain and you get a second blow to the head, there can be catastrophic results, swelling of the brain, bleeding into the brain. So if a child has had a concussion, or anyone for that matter, they can't get back into a condition where they might get another blow until it's healed. We also know that recurrent concussions can lead to dementia. It's a term called chronic traumatic encephalopathy. It occurs from multiple concussions, but even more likely with multiple mild blows to the head. Those can accumulate and cause dementia. So you need to be very careful with the kids with concussions, mild blows to the head. Teach your kids to keep their head up and away from damage to the brain.
The professional football player Damar Hamlin has certainly opened our eyes to the risk while playing in sporting events. What do parents need to know to help minimize the risk for their children?
It's important to understand that the leading cause of death in young athletes is heart conditions. Now, he had one where there was a blow to the chest, stunned the heart, and essentially stopped the heart from circulating blood. There's actually two conditions more common than that right now. I've got a heart model to show you. There's one where the heart muscle gets abnormally thickened. That's a genetic condition called hypertrophic cardiomyopathy. That can be picked up on exams in advance. Also, the blood vessels that bring blood to the heart, they can be in the wrong places in some kids, a rare condition called congenital coronary anomaly. That's a tough thing for me even to say. And that can be picked up in advance also. So you want to know if kids have any chest discomfort with exertion, palpitations, shortness of breath with exercise. Those can be tip-offs for more extensive testing to help prevent heart conditions being a problem with young athletes.
Dr. Winter, I'm so happy you had to say that word and I did not have to say it. So we talked about, of course, getting checked out. So do these sports physicals go above and beyond those regular school physicals that a lot of us know about?
They do, and for a good reason. We want our kids to be safe. But let me point out that I think sport activities are very important for children. They help teach socialization, principles of teamwork, build confidence. And they also have been shown to actually decrease the chance of kids getting into trouble with drugs or alcohol if they're in sports. So very important. We want them to do them safely. A thorough and thoughtful physical exam in advance is important.
Okay. Dr. David Winter, Baylor Scott White, thank you so much for joining us this morning.
Thank you, Tashara.